Good morning. My name is Masimba Mareverwa. This is the Inside Podcast in Focus. Today I have Gregory, whom is a fellow actuary. Hi, Greg. How are you?
Hi, Masimba. Well, thanks to you.
Good, thanks. Good, thanks. How has the conference been so far?
I just arrived this morning, so but from what I've seen of it, it's been great.
Okay, so you were at the festivities last night.
I was not. Yes, I heard they went on to about 2 a.m.
Yes, they did. But I guess maybe before we get into the podcast, maybe just to hear a little bit about you. Who's Greg? I mean, I'm an actuary, so I know very well who you are, but for some of our listeners.
So, I think most of my career has really been in the litigation environment. So I've been involved in a lot of matters involving, I suppose the most well-known one was probably the life dominion arbitration, where I gave evidence, and then I've been involved in quite a few other high-profile cases in the courts. And then our run-of-the-mill sort of work is things that, for example, like medical negligence. We do family law matters and road accident fund cases. So, but I've also done a bit of healthcare work in the past and some pension valuation work as well.
Okay. So in terms of the fraud work you do, does it span across multiple industries, or do you focus within healthcare?
Yeah, it does to an extent. I mean, it touches on short-term insurance, it touches on healthcare, sometimes on pensions. So yeah, it does. I think what I've tried to do is sort of make people a bit more aware that we're not just a silo. It does have impact on a lot of other aspects of actuarial work as well.
Yeah. And I guess maybe speaking for myself as an actuary, when I studied, the work you do wasn't in the notes. So how did you develop that sort of?
Arguably, it still isn't. I mean, many years ago, there used to be in the American exams, they used to have a subject on expert witness work per se, and that used to come under the pensions fellowship. So that's kind of like fallen by the wayside. So you kind of just you fall into it or come across somebody who does it and ask questions. But it has evolved quite a lot over the last few years in terms of we formalized a Damages and Compensation Committee. I think that's been running since about 2009. I currently chair that. So I mean, I was one of the first people on the committee, and it's evolved now where we have quite a significant number of members that are involved in the field, and a lot of people wanting to find out more. And we've over the years we've formalized. We have a APN applicable to our field, and we also got like huge amounts of resources available. We also put out a weekly newsletter, which is I think unique in terms of the committee. So we have I partnered with a case law review expert, and we put out a weekly mailer, and that summarizes 3 cases of interest to actuaries, because virtually every week there's some case that mentions an actuary in the court. And then after that, we have a research section. So we showcase research mostly applicable to our field, but we've also touched on aspects like climate change and class actions and anything that would be of general interest to actuaries in the field. And then we've also got a news section as well, where we collate and summarize news. So that goes out every Monday morning.
Okay.
It is on a subscription basis, but there are quite a few actuaries that are making use of it, and it's pretty big amongst the legal fraternity as well. So we've got quite a good footprint in terms of staying current, and our people who subscribe will always be up to date with the latest case law and developments in terms of what's going on in the courts in the field.
Okay. And I guess maybe just moving to the conference, the title of your topic was "Fraud is not a victimless crime."
Yes.
Can you just maybe give us just a brief overview in terms of just the aspects you touched on in your talk?
Yeah, so I think I just, I started at a very high level where we just look at, South Africa's total spend on healthcare. So it's roughly, between the private and public healthcare system is around about 500 billion a year. And then we drill down further, and we say, well, between the private sector and the public sector, how much is wasted or dissipates due to fraud. So, we estimate, I mean, obviously, as you know, there's lots of different estimates about how much is fraud, waste, and abuse. I mean, there's a lot of factors that come into play. But, based on the estimates, roughly, say, 40 billion falls out of the system. And then I drill down further in terms of like a lot of the work that I've been involved in terms of malpractice and assisting the Department of Health with some of the claims and so on. So, after just a broad introduction, I just drill down into what's going on at the coalface of the medical legal claims, and whether and also looking at sort of reform that's potentially on the way in that sphere.
Okay. I mean, thanks for that. I mean, quite interesting. I mean, I found your topic. I mean, the way you phrased it quite catchy. So when you say it's not a victimless crime, I mean, can you just give us an
so I mean, there's obviously a lot of different aspects of there's lots of faces in terms of there's many faces of fraud, waste, and abuse, and equally so there's many faces of victims. So obviously, look, I mean, it's a burden that everybody shares, because for a private medical scheme member, obviously it translates into high premiums, out-of-pocket expenses, reduced benefits and coverage. And it can also, I mean, for people on the margin who wanting to get it, take private insurance or private healthcare, I mean, the increased expense could mean the difference between taking it or not. And then on the flip side, I mean, I tried not to look at it just in isolation in terms of just the private sector, because I think it's important to note that, I mean, whatever happens in the public sector as well has an important knock-on effect for the private sector, especially in the medical legal sphere, because because we have a common law system. If there's a judgment that goes a particular way, that would have an impact on ultimately private sector medical insurance rates for doctors, which obviously then get passed on to the scheme ultimately. So I think the other thing that I pointed out, I mean, there seems to be also exploitation of plaintiffs in medical legal matters. So you'll find a matter might go through the courts for 20 days or 30 days, and most of the lump sum that was destined to take care of this person for the rest of their life dissipates into legal expenses and expert expenses and so on. So I think there's a fine line between giving a person access to the courts and access to justice, but then on the flip side, how much do they actually benefit at the end of the day? And I think we highlight a lot of problems in the system and also suggest some solutions in terms of where can we there's no for example, there's no monitoring of an award. Once a matter is settled, the money allegedly gets paid into a trust, and once that happens, there's really no checks and balances in terms of what was actually claimed. Is it actually is the money actually spent on what was claimed? How much is actually in those trusts once the attorney has taken their fees and so on. So there's a big missing link, which is actually something I highlighted in a paper in last year's journal as well.
Okay. I mean, you touched on a few things, but I guess maybe just to finish your thoughts just on the cost of medical legal claims on the system. I mean, I guess maybe just for our viewers, just to give them a sense of just how big is that impact on us. I mean, you talked about the 500 billion, then let's call it 40 million is
fraud, waste, and so out of that 40 million, so then you would say, well, how much goes to medical legal claims? What we do know from the public sector is they're paying about 2 billion rand in claims a year, but there's a big backlog, so that number is potentially misleading. And there was also recently a really big court case surrounding whether they could pay the amount the claims that had already been settled out in installments or not, and they were ruled against. So they might have to make a fairly substantial payment in the coming year or so. So that might bring that figure up substantially. So off the top of my head, I would say possibly 10% of the 40 billion gets wasted on medical negligence claims. You're looking at it's almost like 10% of 10%. So you're like 500 billion rand medical scheme industry at a high end, maybe 40 to 50 billion in fraud, waste, abuse, and then a subset of that, which is probably about another 10% or so.
Okay. So I mean, it's a big number.
It's a big number. Yeah. Look, I mean, it's undoubtedly it's billions. So it's not
it's not insignificant.
Absolutely.
Okay. And in terms of, I guess, maybe indirect impacts on the system, because I guess the monetary one is one, we can quantify that. I mean, what are some of the other indirect impacts that these claims have on the system, both private and public?
So, yeah, look, I think the one is, the glaring one is, I mean, if you look at we did a claims analysis of one of the provinces that have paid out about 3.5 billion rands worth of claims. And if you look at the quantums involved, we drilled down a bit in the data, and basically 124 claims that were settled accounted for about 2.4 billion rands worth of expenditure. So that money is 2.4 billion rand has effectively been spent on only 124 people. How much does that leave the rest of the province? As you well know, I mean, Insight's done quite a lot of work on the uninsured population, or estimates of the insured and uninsured in the various provinces. The Eastern Cape is the most uninsured province out of all of the provinces. And I mean, you're sitting with millions of people who rely on the public healthcare system with a limited budget. And now you're taking 2.4 billion out of that limited budget only in respect of a handful of people. So one of the real things that need to be tackled is whether that's constitutional or not. So whether the Constitution should be allowing large lump sum benefits to a select few people at the expense of the broader populace.
Okay. All right. I guess now just sort of moving a little bit away from that is that the theme of the conference is focusing on the patient. How does fraud, waste, and abuse, and medical how does that impact the patient?
Yeah. So I mean, when we talk about patient, I mean, everyone will probably think of, well, is it? They generally think of just the private sector, but I mean, for the vast majority of South Africans, the reality is they're covered by the public healthcare system. So, 50 million people are basically reliant on the public healthcare, and maybe we've got about 9 million people it's pretty static at 9 million medical scheme membership in the country. So, obviously, at the private sector level, the impact is, as I mentioned, increases in they're fielded in their pocket effectively. But also, I mean, the general population of our taxpayers, every time there's a medical malpractice matter, I mean, it arguably increases your taxes. And so, I mean, we all feel it. It's just and then look, the fact of the matter is you're never going to eradicate it. There's a lot of things that we discuss in terms of, and the South African Law Reform Commission has done a huge amount of work, and they've put out a few discussion papers, and they're busy finalising a report in terms of reform in this particular industry, and they're looking towards regulating certain aspects, and also there's a huge amount of legal costs that are wasted throughout the system. So they're trying to address that via various mechanisms such as mediating cases and so on.
And in terms of just, the work you've been doing, you do quite a bit of work in this area. Is how much work is happening? Are we doing enough work? Are we not doing enough work?
So I think I wrote a research paper for the Actuarial Society of South Africa in 2021 on medical malpractice in the public sector, and on the back of that, as far as I know, the ASA is going to be releasing another 4 research papers, I think in July, and next month's public interest conference, those papers will be discussed as well. So they have built on the work that I've done. So there's definitely been, especially through Lusani Uladi, the public interest actually, he has built on the work that I've done, and there have been expressions of interest sent out, and some members have taken up the task to take some of the initial work that I've done further. So we have drilled down on certain aspects which would be of interest to the South African Law Reform Commission. As far as I know, I think they have been invited and hopefully will attend next month's public interest seminar. So it's certainly evolving. It's a complex problem, but ASA has thrown some resources behind researching the aspects that need to be tackled.
Okay, that's good. Because I guess maybe as a profession, following on from the Section 59, it did slow down the pace a little bit. But I guess as the profession takes it seriously, maybe in the future there'll be more guidance notes. It will make its way into the syllabus, I think, which should help everyone.
Yeah. No, I think we should adopt the, take bite sizes at a time, just to you can't go and solve the problem from the top down. So if we can identify certain areas where there's glaring holes, and what that is what we have done, I think, then one can address those and then build on that. So we just need small sort of public interest victories as you go along.
Okay. No, that's perfect. Okay, thanks for taking the time. It's been a brief chat, but it's been quite informing and quite edifying. And thanks for all the good work that you do. I know you're sort of charting the way for the profession and I guess the industry. And thanks for taking the time to chat.
Pleasure. Thanks very much for chatting.